With the technique of intrauterine insemination, sperm is provided either by the male partner or by a third-party donor whose sperm has been stored in a deep-freeze sperm bank. Before insemination, the sperm samples are prepared in the laboratory. They are assessed for safety, quality and quantity and then passed through a filtering system for grading and washing. With a syringe and fine tube, the prepared sperm cells are then introduced directly into the cavity of the uterus, beyond the mouth of the womb and the cervix. They immediately make their own way towards the uterine tube. The objective of IUI is to bring these sperm cells as near as possible to the egg. Nevertheless, only the most mobile sperm cells will actually reach the egg, and only one will penetrate the outer layer of the egg to achieve fertilization. But just as in everyday life, there are many times that fertilization fails and the cycle passes without a pregnancy.
Actually, IUI is a kind of procedure where we push the husband's sperm or the donor's sperm inside the uterus of the wife. So when there is some cervical factor of infertility or some factors, male factor is associated. Most important picture is this one. If you follow this, first of all, we would like to create some more eggs so that there is superovulation or hyperovulation. More number of eggs will increase the chances of getting pregnant. And if we put a catheter inside the uterus, it will enhance the chances of pregnancy because of approximation of gametes. So what happens, once we are pushing the sperm inside the uterus, it has to travel less to reach to the ovulated egg inside the uterus and inside the fallopian tube of the lady. That increases the chances of getting pregnant, and it increases by 11 to 20% of a pregnancy level. So IUI is a cost-effective procedure so far as Indian population is concerned. Is cost comes up like within 5 to 7,000 or 8,000. It's not much costly. Any couple can afford this. And one important point is that it transcends lots of barriers, like those couple who can't do proper relationship. There are impotency factors association. All ladies who are having cervical factors, or there is some unexplained factor in infertility. In those cases, IUI gives a good success rate. So it's a cost-effective treatment, and definitely it requires lesser skill, lesser infrastructure, and also it's very patient friendly. You need not come to the clinic very often. Only 1 or 2 visits or max to max 3 visits will suffice to get pregnant. So thank you very much. This much for an IUI cycle. If you have any questions, please feel free and write us to our inbox. Thank you.